My name is Simon Tucker. I am a consultant of emergency medicine at Blackpool Victoria Hospital. Accident and emergency departments and ambulance services are facing increasing demands. We need to ensure that the emergency services are free to treat patients with life-threatening conditions such as strokes, heart attacks and serious injuries. In the North West, we are currently backing the Choose Well campaign. This aims to provide the public with information about alternative places where they can seek medical attention. If you or somebody you know suffers from a common ailment such as cough, cold, flu, headache, backache or sports injury, there are a number of things that you can do in the first instance to help treat yourself. These common ailments can often be treated with medications that can be bought over the counter. Your local chemist will be able to advise you on what medications to take. Sports injuries can occur as a consequence of not warming up properly before exercising, exercising too hard for your current level of fitness, or using inadequate equipment. Common sports injuries include minor cuts, lacerations, sprains, strains and ligament injuries, and blisters. Mild muscle injuries and sprains can be treated at home with RICE therapy. RICE stands for rest, ice, compression and elevation. Rest. It's best to avoid activities which aggravate the injury. Application of an ice pack for 10 to 30 minutes, use of compression bandages and elevation can help reduce swelling. Pain relief medications such as paracetamol and ibuprofen can help reduce pain and reduce inflammation. You should avoid aspirin in children under 16 years. Always take advice from a chemist regarding doses and the amount of medication to take. If after 48 hours of RICE therapy your symptoms persist, you should contact your GP. If your symptoms deteriorate or continue to get worse over the following days, you should contact your GP. Please remember to keep accidents and emergency and the ambulance services free for life-threatening conditions.